So you want to be a nurse. Are you sure about that? Are you really sure about that? Don't do it! Yo, who said that? Well, if you've already made up your mind on becoming a nurse, let me guide you on the right path. The first thing you need to figure out is should you and your why. Well, do you like caring for people? Do you like long hours? Do you like working in the night? Because most of the time when you are just starting out, you're going to be working the night shift. Is that something you can imagine yourself doing for a long period of time? And is it something that your parents are forcing you to do? Is it something you're doing for the prestige? Is it something you're doing for the money? Or are you looking to make an impact on someone else's life and caring for those who are really struggling in a really dark part and moment in their lifetime? Well, that's something that you need to figure out. Because if you go into this without knowing those important things, then you're going to really suffer. Nursing school is already tough as it is, but if you're going in it for the wrong reasons, it's going to be 10 times tougher than what it should be. And I've seen many people make that mistake. Honestly, I myself was such a person. I honestly thought that it would be a lot easier than it was, but it turns out that that was not the case, and I would hate for you to make that same mistake. What exactly is it that a registered nurse does? Well, that really depends on which specialty that you go into. I was in outpatient pediatrics, and so a lot of the things that we did was vaccines, preventative care, very minor illnesses or injuries, and just making sure that people are keeping a steady pace and maintaining their overall health and keeping a balance. Whereas when I worked inpatient, I was working on a telemetry floor. I was working on a telemetry floor, and so the patients were, people who had heart attacks or strokes or heart arrhythmias, really anything related to the heart, chest pain, shortness of breath, dizziness, dealt a lot with EKGs. People were sometimes on, LASIK for congestive heart failure, and we would need to monitor their urine output and things like that. One of the biggest things as well is passing medications, meaning giving medications on time, giving the right medication to the right patient, and monitoring whether they're responding to this medication or not, or if it's causing adverse effects that can potentially be life-threatening. That's something that you really need to ask yourself, is that something that I can see myself doing? For me, having someone's life in my hands was very anxiety inducing, and it took a toll on me, and that's also something that you need to figure out whether can you mentally handle it, can you physically handle it. Those are very important factors to making your decision on whether you want to be a nurse or not. And so how do you become a nurse? What steps of education do you need to complete in order to get to the end goal? So first, of course, you need to finish high school. You have to have a high school diploma, and then you need to pass typically a four-year college nursing program. There are 1 to 2 year advanced condensed programs for people who already have a college degree in something else. Most nursing schools now require students to take entrance exams, either HESI or the TEAS. Luckily, when I was in school, that wasn't really a thing yet, so I lucked out on that. And so some other things that they look for are prior healthcare experience. So if you worked as a nursing assistant, CNA, or a medical scribe, or even if you volunteered, and just so they know that you've got a sense of what it might be like, and you're not going in there blind. what I really recommend for you is to shadow nurses in multiple departments or specialties, and really get a first-hand glance at whether you can picture yourself doing this. Because reading online and listening to people talk about it is very, very different than experiencing it yourself. That's something I didn't do in the beginning, and that was honestly a big regret of mine. Had I done that, I honestly don't know if I would be here 8 years later. But that's something that you need to really, really take in and fully accept. Otherwise, you might be kicking yourself, in the foot later down the line. Now, once you get into college, how do you succeed? How do you study? How do you learn what you need to learn in order to pass the test? Nursing school really doesn't do a great job of teaching you how to be a nurse, but its main goal is to help you pass the NCLEX, which is the licensing exam for nurses. And so in school, what I highly recommend for you guys to do is, when you're starting your classes, you need to learn how to study. So there are many different techniques out there, things like Pomodoro technique, but you have to manage your time well. You have to set a certain time during each day and really focus on studying, and so that way you're not procrastinating, you're not falling behind, because classes move really quick, teachers talk really fast, they don't exactly extrapolate on the things that they say, and you're struggling to take notes, and if you're typing, you got to be a fast typer, or if you're writing, you got to write really fast, and you'll miss a lot of things. And so a lot of it is self-study, and a lot of people go to tutoring. I went to tutoring. I then eventually worked as a tutor. But on the subject of tutoring, don't be afraid to go to a tutor. It's not embarrassing. You're not stupid. You're not dumb. Some things just don't click. For me, one of my weakest subjects was OBGYN, and it just didn't click to me. Even now, I whenever I get a call regarding pregnancy, periods, and birth control, stuff like that, like, it's not something I'm super comfortable with. And so you have to put aside your pride and ego and know when to ask for help, because remember, nursing is not just for study, right? You are studying to become a nurse who is going to take care of real people, real patients, real illnesses, and real diseases. You can't go half with this. You can't put a half effort on this, and so you have to remember that you're studying to remember things that you'll need to use later on. And aside from tutoring, you should ask the professor at the beginning of the semester whether they're going to base their testing off of textbooks, PowerPoints, or whatever else, because that will save you a lot of time in deciding which thing to study. Because if they're basing their tests off PowerPoints that they have made themselves, and you're studying the book, you're going to be studying the wrong things, and you're most likely going to fail, or vice versa. And so most of the time the professor won't have a problem telling you. Sometimes it won't, and then you're kind of winging it at that point. But another thing you could do is, if you can network with the older students, the sophomores, juniors, seniors, and ask them what that particular professor did for them, perhaps you can get a sense. And after you take a test, this is very important. If they offer exam review, which a lot of them do, you should go to the exam review, especially if you did really bad. And even if you did good and you got a few questions wrong, you should still go. And the reason is because you need to know why you got those questions wrong, because it might show up in the midterm, it might show up in the finals. But most importantly, it's something that you'll want to remember, down the line. And oftentimes, the professors, when you go to the exam review, and you correct your answers, they may give you full credit back, or they may give you half credit. And by now, you should know that nursing schools have a cutoff for whether or not you pass. For me, it was you had to have above a 77 average, which is actually pretty generous. Some schools are upwards towards 82, 83. And a lot of the time, if you fail a class twice, you're kicked out of the program entirely. And you cannot reapply. The only way is if you apply to a different nursing program at a different school, which is obviously a huge time waste, huge money waste. And so you really want to try to avoid it. In terms of studying, you need to figure out what method that works best for you. Do you like flashcards? Do you like reading off your laptop? Do you like printing your notes? Do you like watching lectures? Do you like a mixture of all different kinds? Do you like studying solo? Do you like studying in groups? That part is really, really important. I was a huge solo studier. Every time I went to study with my friends, like, they got off track, they got distracted, and in turn that distracted me. Obviously, you need a break sometimes. You can sit by yourself, and then when it's break time, you can go over to their table and just kind of relax your brain, decompress your brain, and just have fun with your friends. But when it's time to study, you gotta really hunker down and study. Put on some headphones if that's what your thing is, listening to music, like Beethoven or K-pop, whatever it is. You have to really find what works for you, and when you do find what works for you, don't let anyone else tell you otherwise. They'll be like, oh, Jimmy, come over here, like, we can study together, bounce off ideas, which is not bad, because sometimes they know things that you don't. But if that's not really your thing, then you got to learn to say no. Otherwise, you're wasting time, you're wasting resources, and your grades are going to suffer for it. One thing that was popular among me and my friends was we would sometimes make our own questions, and we would give each other the tests to take on our own time and just kind of test our knowledge, because when you do practice questions, it really solidifies the knowledge that you've learned. But also, when you make the questions, it really forces you to construct the question properly so that people can answer it. And by doing that, you also gain the knowledge. There's also practice questions, in the books, or sometimes the PowerPoints that the professors give you, with the answer key. And you should always do those. Read the rationales, figure out why you're right. Most importantly, why you are wrong. Because when you review questions that you get wrong, your understanding becomes much more deep than when you're reviewing something that is right. Because you already kind of have a sense, but when you get it wrong, you really have to dive deep and figure out where your thinking was wrong. And by doing that, you spend more time and more effort, and it becomes more solidified in your memory. One important thing to not neglect is networking. You should network with fellow classmates, professors, teachers, because these people might already be working at a hospital as a CNA or as a staff nurse. And so later down the line, when graduation time comes and you know someone who is working in a specific department that you like, whether it's the ER or ICU, or a specific hospital that you like, you can reach out to them and say, hey, I'm looking for a new grad job here. This is something that I've always wanted to do, and this is something I always wanted to work in. And you never know who might respond back and be like, hey, yeah, actually we're looking for new nurses. You can use me as a referral, and then that's a foot in the door. Because the job market is pretty tough sometimes, depending on the year, and they tell you that there's a huge nursing shortage, which there is, but for some reason it's still quite difficult to get a nursing job. Try your best to have connections, because at the end of the day, connections are really important, no matter what anyone says, because your grades and your resume can only take you so far. If you find a job online that you really would like to do, or that really interests you, but you find that your resume or requirements are not up to par, you should always apply anyway. The people who make these, most of the time, the people who make these job postings are HR people who have next to zero knowledge in nursing and the requirements, but they're required to put these certain terms for legal reasons. You never know what job will respond to you, but if you don't apply, they never will, because they won't know who you are, and it's just not going to happen. So just apply. That's what I did when I got my job as a telemetry nurse, inpatient. The manager reached out to me, and they're like, hey, I know you don't have the experience, but I see that you took the effort on your own time to get the ALS certificate, and so we get a sense of what your effort level is like and what kind of worker you would be, and that's how I ended up getting the job. And the manager was really impressed that I did that on my own time. I did that because for this specific reason, but also because I wanted to be prepared, because I knew that working in telemetry and having patients with heart-related problems would lead to potentially needing resuscitation and advanced resuscitation. And so don't be afraid, just apply. Once you graduate nursing school, the next step is taking your NCLEX RN. And this is the whole reason you've gone to nursing school in the first place. Nursing school was meant to prepare you to pass this test. This test has in recent years changed format, but really the format honestly doesn't matter, as long as you know what you need to know and have the critical thinking skills, which is the whole reason why they changed the format in the first place, is to make incoming nurses have better critical thinking skills, because they found that with the previous testing format, the nurses that were coming into the workforce, their critical skills were lacking. But at the end of the day, as long as you study properly and as long as you've paid attention in school, the format doesn't matter, because you're able to apply the knowledge that you have. You can take some prep courses. They've got a whole bunch, like Kaplan, things like that, and Archer. I took one at the time. It was a very popular one. I don't even remember the name of any anymore, because it really wasn't that helpful. Yeah, but that option is there. For me, what worked best was really just doing practice questions. I did over probably 2,500 practice questions, and that really prepared me for taking the NCLEX. What you shouldn't do is what I did. Is I came fresh out of school. I thought I was ready. I said to myself, I don't need to study. Like, I've got this. Like, this is nothing. This is gonna be a piece of cake. And so I took the test, and at the time, there's a range of questions you can go up to. It was 75 to 180, I think it was. And and the way that the test works is that it's a constantly analyzing test. And so what that means is, if you get a question wrong, they're going to give you a similar question on a similar topic. And if you get it wrong, they're going to do the same thing. And then if you get it right, then they can move you on to the next topic. And that's still how it works today. And so I ended up taking the test and going all the way up to the max questions. And I actually ultimately failed, just by a very slim margin, which was really disappointing, because you have to waste time. They make you wait 45 days until you can retake, probably because they're giving you time to study. You waste money. The test is, a couple $100. And so after that, I did another probably around 2,000 questions, and I really focused on reading the rationales, because that's where you learn the most. You learn not just memorizing, but truly understanding the question and why you got it wrong, and the content of the question. And when I went to retake the test, I knew for a fact 100% that I passed. I was going through these questions. I'm like, a lot of them, like, I came across during my practice questions, and I was like, they changed up the facts a little bit, but the format of the question was essentially the same. And I breezed through that test. I ended at 75 questions, the minimum. I honestly I probably got maybe a few wrong at most. And I walked out of there knowing, like, I guaranteed passed, just because I prepared so well this time around. And I threw away my pride and ego, and I said, okay, let me study. Let me actually take this seriously. You need to take your studying seriously. Don't be arrogant like I was and waste time and money. If I haven't scared you away yet, that's the basic rundown of becoming a nurse from high school student up until graduation and passing your boards. I think that the decision to become a nurse is a very big one. I think you need to take a lot of time. You need to talk to a lot of people and get feedback from them and see whether or not this is something that is fitting for you. A lot of my friends during and after graduation came up to me or messaged me and said, why did you go into nursing? This is like your worst nightmare. You hate working during the night. You don't like getting yelled at, and you work long hours. And a lot of the time, it's not gratifying. You deal with a lot of abuse, physical, verbal, emotional, and it really takes a toll on you. And you have to decide whether that is really something that you are willing to go through with. And down the line, if you do go through with it and you pass your NCLEX, you become a full-fledged nurse, and you find that it's just really not something you want to do, don't be afraid to switch. People will say, oh, but you wasted so much time, you wasted so much money, you put in so much effort for your license, which is true, but that shouldn't hold you forever. That shouldn't be a restraint for the rest of your life. If you feel like you need to pivot into something else, it can be something totally different, cooking, IT, then just do it. Because you don't want to be miserable for your entire life. We've all met miserable people at their jobs, and I've met plenty of those nurses. They're grumpy, they're hateful, they're rude, they hate new nurses, and it's like, don't let yourself become that person. And it's not pleasant to be around. And so, trust in your instincts, because you know yourself the best, more than anyone else in the world. I hope that you make the right decision, and if this is something you are really set on, then hit the like button, hit subscribe, and follow me, and I will guide you to the right path.